From WNPR, I'm John Dankosky, and this is The Wheelhouse.
President Trump had a previously undisclosed second conversation with Russian President Vladimir Putin on July 7th.
This is a worst-case scenario for Senate Majority Leader Mitch McConnell. Two more senators have announced that they also cannot support the Senate version of health care reform. That brings the number of 4 Republican senators who say they cannot support this bill. That is not enough for Senate Majority Leader Mitch McConnell to even get this bill to the floor.
Republican leader Mitch McConnell has already announced his Plan C. It is a Hail Mary pass that puts a number of his own Republican members in a tough spot. He's asking them to vote on a straight-up repeal of most of Obamacare with no replacement.
Soon after Senate Majority Leader Mitch McConnell made his pitch to repeal Obamacare without a replacement, 3 senators said they would not support a vote to bring the new version of the bill to the floor, essentially killing the measure.
And I think we're probably in that position where we'll just let Obamacare fail. We're not going to own it. I'm not going to own it. I can tell you the Republicans are not going to own it. We'll let Obamacare fail, and then the Democrats are going to come to us and they're going to say, how do we fix it? How do we fix it? Or how do we come up with a new plan?
Those are some of the stories we'll be talking about today in The Wheelhouse, our weekly news roundtable, with Colin McEnroe, host of The Colin McEnroe Show here on WNPR. Howdy, Colin.
Apparently a new thing in Washington is everybody says everything twice.
Yeah, you just have to, you say it twice.
How do we fix it? How do we fix it? Let it fail, let it fail.
We'll try that throughout the course of the day with Matt Dorenzo, who's Executive Director of Local Independent Online News, or LION. Hey, Matt, how's it going?
Good morning.
And Danielle Altamari here, she covers the State House for the Hartford Courant. Hello, Daniela.
Hi.
If you want to join our conversation, 860-275-7266. Comment on our website, wnpr.org/The Wheelhouse. And you can find us on Facebook and Twitter at WNPR Wheelhouse. In a bit, we will be turning our attention to the state capitol. But first, let's go to Washington, where, as we heard, this GOP attempt to repeal and replace Obamacare has not died just one death, but perhaps 2 deaths within 1 week. Senator Jerry Moran of Kansas, Republican vote almost all the time, announced his opposition on Monday, along with Senator Mike Lee of Utah. Colin, they went as a team, in part to not draw too much attention to either one of them. But even if the 2 of them had decided that they weren't going to vote for Trump Care or the Better Care Act or whatever we're calling it today, it seemed as though this bill was pretty much DOA anyway.
Right. I mean, I do think it's probably a mistake to count individual particular noses. There just weren't going to be enough noses no matter what. And one of the things that you're seeing here is that, MS and Parkinson's disease and opiate addiction, they don't pick political parties. They don't, MS doesn't say, well, only Democrats are going to get this disease. So the people who have medical problems, chronic medical problems, who need access to health care, they can't afford conventional means of getting access to health care. They don't have private insurance through their employers, whatever. They're from all political persuasions. And so just because you're from a really red state, a pretty red state like Kansas, that doesn't mean that you don't have a lot of people there who are sick, who are very worried about a benefit being taken away. And I would also just say that, what's happening now is this kind of sharp set of pivots. Trump, you heard him, one of his new arguments is let Obamacare fail, which is not a particularly inspiring thing to hear. And it's bad politics, too. One of the things we now know is people don't like having benefits taken away. So if you say, yes, my plan is to let this thing fail, that never sounds very good anyway. And in substance, it's really not good. The other problem he has, and I'll shut up, is that he wants to pivot sharply towards something else. So do the Republicans in Congress. But the things that they have to pivot towards, they're not ready to do either. And so now you start talking about tax reform, infrastructure, budget. Well, you can't have tax reform if you don't have a budget. Just ask Daniela, which we will do eventually. But and infrastructure is not happening because this administration is not good at carrying out multiple game plans or even single game plans.
I heard earlier this week, Matthew Continetti, he's a Republican conservative writer who periodically appears on Morning Edition, to give the conservative take on political questions. And in some of the things that he said really struck me. He told David Green, the fact is Republicans have always had trouble with the health care issue. They've never really been able to agree on what they want to do. Later, he said the health care lack of consensus I mentioned has been longstanding. Republicans are uncomfortable talking about health care. I actually think when you get to something like taxes, judges, deregulation, there's much more unity because these are much more traditionally Republican conservative issues. Not to make Matthew Continetti the voice of the entire Republican Party, but as Colin said, I think we hear this a lot. We hear this from rank-and-file Republicans who comment on things on Facebook that I see all the time, people that I talk to, people at the State House in Hartford who are Republicans, senators as well. There's this sense that health care isn't a Republican issue. But like if health care isn't a Republican issue and there's a whole bunch of sick people in America and a whole bunch of people who need to go to the doctor and be well, aren't they going to need to figure that out to govern and stuff?
Well, I think Colin mentioned Kansas, and I think a pivotal point in this whole health care, whether this was going to come to a vote or not, was when Senator Jerry Moran went to I think it was a district that had voted 84% for Trump, and there was a town hall packed with people making that point. Yeah, we voted for Trump, but I have a pre-existing condition, and if you dismantle the Affordable Care Act, I'm going to be in trouble. So I think Obamacare was easy to demonize because it had that word Obama in it. And but now that it has changed people's lives for the better, it's going to be difficult for them to move forward. And I don't think they have a plan. And you see there's a lot of culpability here amongst the Paul Ryans of the world who really have this Ayn Rand philosophy where they don't believe that the government should be involved in it at all, and they don't believe that Medicare should exist at the heart of it. And so that's going to be a real rub against the reality of the situation.
Well, it's a bigger question than the one that usually is had in Washington, which is health care a right? Is it a human right that we should all have? And that's a big conversation that people I don't think really want to get into, certainly not Republicans in Washington.
And I don't think that they have to make that leap. They can just preserve it to keep the U.S. economy intact. When Donald Trump says we're just going to let Obamacare fail, he's saying we're going to let the U.S. healthcare system fail.
A big chunk of the American economy. I mean, something that Colin said too, Daniela, and it applies, and we'll talk about it later at the state issue, at the state level as well, is that no matter whether or not the policies are good, whether or not people feel really good about the health care that they have, nobody likes having benefits taken away. Once benefits of some sort are extended to someone, the idea of rolling them back, or as the president is now saying, letting a whole system fail, that's not going to resonate with voters.
No, certainly not. I think one of the issues you're seeing here is, as maybe President Trump is learning, healthcare is hard. And there are deep divisions on the left as well regarding what we should do with healthcare. I mean, we had a guy running for president who wanted single payer, and he seemed to do pretty well up to a point. So there's certainly a movement on the other side among liberals. I don't think there's any uniformity, and I don't think a lot of people, maybe progressives, think that Obamacare is the absolute best system in the world, and that, certainly people want to preserve it because there's not much else at the moment. But, I think that there are many people in this country who believe that the whole system is, completely messed up.
Yeah, not only is he finding it out, Colin, that healthcare is hard. I mean, remember he famously said that people didn't know how hard it could possibly be. This is really hard stuff. Who knew?
So just to kind of double down on things that both Matt and Daniela said, I mean, what's important to understand here is comprehensive government health care polls really well. Whether you call it single payer or you talk about a public option, typically that polls really well among the American public. And so in a way, the public is running towards one fire to put it out, and the Republicans are running in the opposite direction to put out a different kind of fire. What Americans are essentially saying through polling, through, as Daniela said, support for somebody like Bernie Sanders, what they're saying is we want help with our health care. We want access to good medical care. We don't live in a system right now where we can afford it through private monies. We want you to do something about it. What the Republicans are somehow or other hearing is we want you to cut down government's involvement in health care. We want you to spend less money on all of this. And I don't think that's the message they're getting from voters. It's a message that they're getting from a unique subset of voters, plus they're undergirding political philosophy and, as Matt says, the novels that they read when they were in ninth grade. But I don't think I think it's weird because I don't think this is a particularly popular. Usually when there's this kind of dedicated surge by one party towards a particular objective, it's because they think they have the people with them, but they obviously don't. I mean, this is not what people want to see.
Well, the argument that resonates is, we don't want the government in our health care. We don't want the government telling our doctors or any of us what to do. The problem is that by saying, Matt, let Obamacare fail, or Obamacare is failing in part because these exchanges that have been set up aren't retaining any of these private insurers. Well, what's the answer? Are we going to put it back in the hands more fully of private insurers who clearly were given this enormous gift by Obamacare, millions and millions of people now paying the money, and they didn't want to make that work? If you can't make something work where the law says you have to buy insurance from a private insurer, I don't know what else you could do to incentivize a cost-effective, reasonable healthcare system for people.
Right, and I think that's why you see people on the left talking about the ultimate place where we're going to be is single payer. In the Hartford Courant this morning, on one page the ACA is intact, and another page Trump is going to let it fail, and then on another page United Healthcare profits soar. Right, and my guess is they're going to soar after this as well. They'll figure out a way.
So I mean, how does it play when you talk to people at the state capitol, Danielle, or any of the people that you come in contact with? I mean, is there any resonance with this idea that eventually we're going to get to something with, whether it's single payer or it's some sort of a public option? Maybe states are going to start to innovate around this. I mean, are people starting to talk about, I don't know, even states taking on this responsibility in a different way than they are right now?
I don't hear a lot of talk about the state of Connecticut taking on any additional responsibilities at this point, at least that cost any money. Ultimately, you do hear people say, the cost side of healthcare has to be addressed, and it really wasn't with Obamacare, except in, some ways that didn't seem to really hit at the problem. I mean, that seems to be at the core of some of this. But no, I certainly don't hear anybody in Connecticut. California, there was some discussion. I think it ultimately ended up failing in California, but certainly nobody here is talking about any big ticket items that cost a ton of money.
Well, that is clear. Yeah.
It was kind of a funny question, actually. I mean, you'd have pretty much the same result if you drove down to the Beardsley Zoo and said, "Hey, anybody here have any really interesting ideas about how to fix health care?" They're just trying to get through the day, and they're not even,
I'm trying to give people the benefit of the doubt, Colin. Clearly, they're not thinking about this in Washington. Let's turn to another issue. We have another story with Donald Trump meeting with Vladimir Putin, only this is a different sort of a meeting, a second undisclosed meeting, an intimate, and I'm reading here from the New York Times, intimate dinner conversation of which there's no official United States government record, is the latest to raise eyebrows. Foreign leaders who witnessed it later commented privately on the oddity of an American president flaunting such close rapport with his Russian counterpart. Supposedly, the only third person in the conversation was a Kremlin-paid translator, which is a lot of fun. So I don't know, what are we making of this, Colin, given the fact that we probably assume that Donald Trump had some sort of conversations with Vladimir Putin during this G20 meeting that we didn't know about?
Right. I think, a lot of life these days, at least vis-a-vis the Trump administration, is separating out things that are kind of outrageous from things that should really scare you. I would put this in the latter category. One of the things that we know from his first encounter with Russian officials as a president, with a lot of people in the room, was that he compromised a piece of intelligence, and he did it in the course of bragging about what great intel he had. I mean, our understanding now of how that went down was he was bragging to these Russian guys, I get great intel all the time, and then he gave them an example, and he gave it in such a way so that it was clear that it had come from Israel, with just a little dot connecting. So that's what he does when he has some supervision. Imagine what he's doing with no supervision and a translator who may or may not be acting in his best interests. This should frighten people. I mean, I'm serious. It should scare you that he's sitting in alone in a room with Putin, who we know does not have our interests at heart, and he seems ill-equipped to deal with an even simpler situation than this. So I think it should make people very afraid.
His tweet on this, Matt: fake news story of secret dinner with Putin is sick. All G20 leaders and spouses were invited by the Chancellor of Germany. press knew. So, well, that's Donald Trump's tweet.
Right. Well, first of all, this would be a non-story, I think, if it was either President Bush, for example, because you had confidence that they were listening and not openly rejecting their own intelligence agencies and their influence.
Plus, we knew that President Bush was looking into his eyes,
Right,
deeply into his eyes, to sort of see where his soul was. But anyway, please.
So one of the astonishing things that I think is a undercurrent in the healthcare thing and the Russia thing is the effectiveness that Trump has had in just saying white is black, black is white, and how that's been backed up by Fox News and other right-wing news sources, and the influence that that's had on their base and the Republican Party. So there was a July 15th Washington Post ABC poll that found that only 9% of Republicans believe that Russia tried to influence the election, despite the CIA, FBI, and our intelligence agencies saying so, and evidence, with the Donald Jr. Releasing his own emails, admitting it. That's 9% in July, down from 18% in April. So the more the evidence comes out, the less they believe it. And I think that's that drumbeat from Trump going directly to voters and Fox backing it up and not reporting certain things.
I know. What do you make of this, Danielle? I mean, we've seen so many stories that Colin's very scared about it. Perhaps I'm laughing about it only because, well, of course he had a secret meeting with Vladimir Putin.
Yeah, I mean, this idea that things are not being recorded, that things are sort of being done, kind of outside of the margins is certainly troubling. I mean, the presidency is an office that needs to be documented. There's no under traditional presidents, when the president is done for the night, they call a lid on it, and he's in the White House or he's wherever he is. Trump seems to be throwing a lot of these typical protocols out the window, and it's more than just niceties. This is the press is there to document things. Things are done a certain way, and he's just tossing all that aside.
But to be fair, this is a 21st century presidency, as he's told us. Yes, this is a very different type of presidency. The line in the Times article, Colin, that I thought was sort of interesting is it says, no presidential relationship has been more dissected than the one between Mr. Trump and Mr. Putin, which I suppose could be true, but I don't know. Bill Clinton and Monica Lewinsky might think differently about that.
Well, first of all, give Donald and Vlad time. I mean, they've only had 2 dates so far that we know of. So, I just want to go back to something that Matt said, because I think it's kind of important, and I would interpret it in a very specific way. That notion that the more evidence that comes out, the less that Republican voters believe in Russian interference. And I think, you could go to the people who kind of study the neurology of voting, people like Drew Weston, for an answer about that. In order to support the president, which I think a lot of Republican voters still feel is kind of job one for them, the only way you can do it is to discard this evidence, right? If you're willing to believe this evidence that's piling up in larger amounts before your eyes, then it becomes very difficult to support President Trump. So I think they have no choice, essentially, if they want to stay in the camp, but to discount more and more of the reality that's placed before them. I'm kind of not surprised by that number because I think that's what they sort of have to do.
But they want to stay in that camp because they want the other things that they believe a Republican president with a Republican Senate and House can get them, which are tax cuts and cuts in regulation. The problem is it has been shown so far, and again, it's only half a year into the Trump presidency, that these things actually aren't necessarily working to their benefit. They're not getting the things out of supporting the Trump presidency that they would expect to get from supporting a Republican president.
Well, I think, first of all, some subset of Trump voters aren't that far in the weeds. What they basically wanted was somebody who would defy the conventions of Washington, who would be at odds with the entrenched leadership there. And so they're getting that, right? They're getting a guy who basically doesn't president the way most people president. Well, and so that's what they wanted too. So I mean, at that level anyway, it's not a certain percentage of them are going to say, "Oh yeah, I'll stay the course with this at least for now. This is what I wanted."
And if you believe the EPA overreaches and the Department of Education overreaches, he's appointed people who are making significant changes there and dismantling the bureaucracy or regulations and. And
Right.
also,
Scott Pruitt is probably the most effective member of the cabinet.
Yeah,
because he doesn't have to wait for legislation.
He also got a seat on the Supreme Court, so maybe so far so good.
Matt Durenz is executive director of Lion. Daniela Altamari is State House reporter for the Hartford Courant, and Colin McEnroe is host of the Colin McEnroe Show on WNPR. We will turn our sights to the state capitol, where there's been a lot happening with the state budget. I'm just kidding. There's nothing happening with the state budget. Daniela Altamari will, however, bring us up to date in just a couple minutes here in the Wheelhouse. This is the Wheelhouse. I'm John Dankosky. We're talking about the week's news with Daniela Altamari, State House reporter for the Hartford Courant, Matt Durenzo, executive director of local independent online news, or Lion, and Colin McEnroe, the host of the Colin McEnroe Show on WNPR. You have a show today, Colin. What's on it?
Well, I'm reluctant to say because this is the most frequently postponed show in the history of the Colin McEnroe Show. It's been on the schedule like 3 or 4 other times, and things happen like the Trump-Macron press conference, and we have to blow it off. It's a show about late-night television. We're going to have the biographer, Jason Zinnemann, of David Letterman, but we also have people here just to talk more about the state of late-night television and how much of news consumption has, of course, shifted over into that venue.
Excellent. Talking about late night.
Unless
and
it's
other
canceled.
things.
It might be canceled.
It might be canceled. I hope it's on today at 1 o'clock on the Colin McEnroe Show. So Daniela Altamari is here. She covers the State House for the Hartford Courant, and you've been, along with all of your colleagues up there, digging into what's going on with the state budget. Obviously, we don't have an agreement on a new state budget. We are running the state under some limited executive authority that the governor of the state has. But I guess we should get an update. I was joking about not much going on with the budget, Daniela, but is there anything happening?
No. There's not much of an update. We're waiting to see. Now, one of the pieces is now in place. The unions have voted and approved by a pretty substantial margin a package of changes to their contract that is designed to save the state a lot of money over short-term and long-term, I guess. Now, the legislature was saying they were waiting for this, and now this has been done. So we'll see when they come in. They have a session scheduled for next Monday. It's the veto session where they'll go over some of the bills that the governor vetoed, conceivably, although very unlikely that they would vote on Monday because the budget needs to be printed and there are certain sort of logistical things that need to happen, and there just really doesn't seem to be enough time. So that is, very, very unlikely to happen on Monday. The longer this thing drags out, of course, the more pain there is, and there's already been a lot of pain. Right now it's falling mostly on the private nonprofit providers who, run group homes and day programs for people with mental illness and clinics and employment training for people with developmental disabilities, and it's been pretty bad for them. But as far as other folks feeling the pain, not so much. I mean, the beaches are open, the parks are open. This isn't New Jersey. So the pain has been, felt disproportionately by certain pockets of the state.
And maybe you could explain a little bit more about why this pain is being felt in the way it is, because I think everyone understands that with the budget deficits that we're facing, that any agreed-to package of a 2-year budget will also include some pain. It's not as though there are not going to be cuts to state services, but why the specific pain being felt right now?
So, yes, you are correct. That seems very likely to happen under all of the scenarios we've seen so far. There are very significant cuts. The problem is right now the governor is running the state through these sort of executive orders. So he's able to keep the state open. We didn't close down like Maine. We didn't close down like New Jersey. But this is a very limited tool. This is sort of a blunt tool that the governor has at his disposal. And he essentially said he didn't want to do this. He didn't want to do it this way. He proposed a sort of a provisional budget that the legislature rejected. Basically, what it allows them to make cuts in certain areas that aren't covered by, union agreements and other things. And it doesn't allow him to raise any revenue, and he can't run a deficit. So it's a limited tool. He's sort of forced to make the cuts where he can. And unfortunately, for the people who rely on these human services and these sort of safety net programs, they're in the one area of the budget, one of the few areas of the budget that can be cut.
And I just want to pick up very, very quickly before I turn to someone else, Danielle. You mentioned in there that with this veto session coming up, they're hoping to get some things done, but there might not be time. I mean, globally, none of us have that much time, right? We're only on the planet for so long. But haven't they had a lot of time? I mean, how much time do we need to solve some of the problems that need to be solved?
I think one of the things is they don't seem to have a consensus yet. I mean, with the margins as close as they are in the House and tied in the Senate, they need every vote. And there are certain conservative members of the House of Representatives and 3 conservative members of the state Senate that don't seem to be on board, or perhaps we don't really know whether they're on board or not. So, certainly some House members have expressed real concerns and said as much. They won't support this budget. If you're the Speaker of the House, you need every vote. It's summer, people are away, there are logistical issues. So it's really a sort of a numbers counting game. And if you don't have the numbers, you don't have the votes, you're not going to bring up a budget.
I think, first of all, my hat is off to Daniela. That was, first of all, a very lucid explanation. And also, if I had to cover this stuff on a daily basis, I would fake my own death and move to Switzerland or something. I just couldn't do this. So you are heroic in your determination to make sense out of all this. I think what's important to emphasize just for a moment is the distinction between, and Matt and Daniela will probably have smarter things to say about this than what I'm about to say, but sometime in the 90s there was this increasing shift towards what we were calling at the time privatization, but what really amounted to shifting the delivery of services formerly delivered by the state, by state workers, to the nonprofit sector. And this happened probably most preponderantly in the category of services delivered to the most vulnerable parts of our population, the very sick, people with disabilities, people with mental disabilities, people, anyway, you get the idea. And the problem here is that the state employees, on the one hand, can negotiate these concessions that have things like, if you agree to some of these concessions, then you don't have layoffs for, is it 4 years? Mm-hmm. Yeah. Well, these people, these nonprofits, they can't do anything like that, right? Mm-hmm. They have to have money to pay people, or they don't have people working there. They can't negotiate things like that. And so they're really in a panic at this point. I think that's probably fair to say. It's why last week I said, look, pass the mini budget or the provisional budget. I mean, if you can't do anything else, do that so you can stabilize these poor people. I mean the poor people working at the nonprofits who are helping other poor people who have terrible problems, and this is a mess for them. It's really horrible, and it's immoral that the legislature has been so dug in about this that they couldn't put at least some of their differences aside and get something on the table that would at least stop the bleeding in this really impoverished and easily damageable sector.
And one thing I'll just say quickly, Daniela, is that something we've learned from working in a nonprofit here in public broadcasting is that this quarter, the first quarter of the year that comes after the new fiscal year, is absolutely the worst for every nonprofit. Whether or not you're providing much-needed social services or whether you're some dude yammering on the radio, this is hard. Mm-hmm. A lot of these businesses, they only have money at the end of the year.
Yeah, and the system is incredibly shaky as it is. It isn't like this is a system that's been flush with funds and has been, we're going to have to cut you off for a couple of weeks. You're going to have to suck it up. These people are strapped, even under the best of circumstances. They haven't had raises in, over a decade. They haven't, or increases in funding in over a decade for the most part. I mean, this is a system that is really weak and underfunded and in badly needing shoring up to begin with. So you take away that, as you said, and it just can be devastating.
Yeah, I mean we've outsourced the safety net, right? And I think there's domestic violence agencies and others right now that are worried that it's going to lead to tragedy if we don't resolve it. I wonder if you mentioned the closeness of the GOP gains in the legislature and how it's more difficult to reach consensus. I wonder if that's happened also at a time when the Republican Party has become more Trump-ish and combative, and the absence of people like Andrew Rohrabach and John McKinney from the legislature might be causing.
Yeah, I don't really see that. I think most of the Republican leaders in Connecticut are pretty middle of the road. I mean, Len Fasano is not a someone who goes on Twitter and, says outrageous things like our president. I don't see that. There, maybe certain members of the Republican Party. There was a House member just this week who, posted some sort of inflammatory things on Twitter. So, there are.
So we hear from them, but behind closed doors, it's a reasonable.
Well,
conversation.
from my perspective, I don't see the leaders of the Connecticut General Assembly on the Republican side being in the Trump mold.
And maybe not in the Trump mold, Colin, but certainly maybe opposing the deal that the governor has worked out, that the state employee unions have now ratified. They're basically saying, once again, as they said the last time that we did this is a bit too generous a deal. It gives away too much. Daniela said it will save money in this upcoming year and the next year and over the course of the next however many years. But Republicans are standing up and saying it could save more.
Right. This is the part of the conversation that's going to get me an email from Larry Cook, who is from the Democratic caucus at the state Senate. So I think you have to sort of separate at least two things. And those two things are reasonable objections that the Republicans may have or reasonable questions that the Republicans may have about union concessions or other aspects of the budget. I think Len Fasano is I know I'm going to get an email, but maybe I'm wrong about this. I think Fasano is right in saying, why can't we see this stuff sooner, faster, more clearly? Why can't we see these contracts? Why can't we know exactly what's in them? I think that's a fairly reasonable question. I'm sure I'm going to find out why it's not. But so there's sort of that. And then undeniably, and maybe this is more what Matt's talking about, there's a lot of positioning for 2018. Now, there always will be positioning for a gubernatorial year election, not only among people running for governor, but people trying to hold their seats. And it becomes even more important to hold your seats or gain seats at a time when the balance is so close and tippy in both chambers. So you've got a lot of people who, they might have made some of their decisions in the past from a craven political calculation, but that knob has been turned up quite a bit. The setting on that is going up to a kind of a Spinal Tap 11. So there's some of that. That's one of the reasons. I think everybody agrees. I think even they agree that that's one of the reasons they're having trouble reaching consensus, is because it's not just about a budget. It's about how this budget plays out as an election issue in 2018. But I also feel like I don't want to completely discount the Republicans, because Danielle is right, too. I mean, Fasano's not some kind of wild-eyed ideologue. I mean, the person who tweets about reality television is Mark Boughton. So that's the Trump through line. But I think some of Fasano's questions are reasonable, and I think it's reasonable and fair to ask, are these concessions enough to stabilize this problem? Are they a Band-Aid or are they a gallbladder removal, right? I mean, we need surgery. We don't need a Band-Aid. So which are these,
I think one of the things we've heard over and over again from Governor Malloy since, probably before he was elected and certainly after he was elected, that, he inherited these problems. He was handed these problems by his predecessor because nobody dealt with some of these issues. Republicans are, and other people too, not just Republicans, are saying, this deal that the unions voted on extends the contract for 10 years. You can imagine in a couple of years, Governor Lumage or Governor Lembo or Governor Visconti, I don't know, Governor Boucher, any of these guys,
Keep going.
Governor Drew,
This is great.
standing, in the old judiciary room of the state capitol and basically saying the same thing. I've been handed this problem by my predecessor who locked in this agreement by, to 2027. Now, without that, the unions may not have approved it. It might have been a non-starter. Certainly that's what the governor's folks have been telling us. So, perhaps there was no other way around it. But certainly locking in these terms till 2027 is something that some people have questioned.
Will we? My question is, will we ever get an open renegotiation of state contracts, or will it continue to be just extended and extended? And and I think from a Republican perspective, if 83% of union members approved the deal, it probably wasn't tough enough. I think it's probably their perspective.
Right. I mean, I think that's what the Republicans are saying. I mean, these contracts, it's weird because these contracts tend to pop open at different times anyway. So the fact that they're able to get broad spectrum agreement at a time when the typical incentivization doesn't exist is, I mean, it's good that they got anything, but you're right. I mean, I still think this is a question, like, is it enough? The structural problem seems pretty big. The pension part of the problem doesn't seem to be fully addressed, at least in terms of full funding. So that part of it seems to be pushed also down the road a little bit anyway.
And no one knows what the state's economy is going to look like in a decade. I mean, it's you're locking into something, and there's a big question mark. So nobody really
It's
knows.
going to be awesome.
We're going to have jetpacks.
I'm telling you right now, it's going to be awesome. Well, you mentioned that Governor Molloy has said during his tenure, which of course will end after this term because he's not running for re-election, that he was handed a lot of problems. He's tried to solve some of those problems. What it's seemingly gotten him is not a great approval rating. Morning Consult comes out with these polls. Turns out, Daniela, he's now in third place. He's the third least popular governor in America after Sam Brownback, the Republican in Kansas, who runs, as Matt said before, seemingly some sort of failed state in the middle of the country, and behind Chris Christie, who is the most unpopular governor in America, who not only shut down the state, but made a gigantic sand statue of a middle finger sticking up so that everyone could see that he's using the beach house while he's closed down the beaches. The governor is I think trying to solve some of these problems. He's not really gaining in popularity. I don't know how much it matters to him personally right now that he's not running again, but what do you see in this poll?
Well, I mean, it's no surprise. He's always, he's struggled for a long time. I don't know if some of these issues are personality, some of these issues are policy. Certainly the state's overall economy would seem to, impact it. I mean, who knows? It's tough to say without really kind of.
His unpopularity boggles my mind. I have to say that, or maybe one of the 20% or something like that, because I think he's been serious. He has gravitas. He has had as someone said this morning, actually Dan Haar in the Hartford Courant, he had a plan. He's worked very seriously on addressing very difficult problems with the state. We have one of the best quality of life in the country. We have some of the highest income in the country. Yes, it's expensive to live here, but
Yeah, but I don't know. Businesses keep leaving. People keep saying terrible things. The Atlantic writes awful articles
maybe
about
that's
us.
a segue to talking about Colin's column later. But man, I think we give outsized importance to one company leaving.
And the company's not leaving. Yeah.
Right.
Just the headquarters.
I do think, first of all, there are these kind of Connecticut goggles, where everything just sort of looks a lot worse. Charlie Baker's the #1 rated governor just, across the line in Massachusetts. And Massachusetts has all kinds of economic advantages that we don't have right now. But those are not necessarily the product of Charlie Baker's hard work, nor are our disadvantages the product of Dan Malloy's dysfunction.
Charlie Baker's the governor of Boston, right? And that helps.
Yeah, that helps. So, back to that whole issue of inheritance. I mean, there was no way that no matter how much time you gave Dan Malloy, he's not going to be able to turn Hartford into Boston. That's just not going to happen. So, I don't know. I tend to agree with Matt that I think history will be kinder to Dan Malloy than the president. I don't know how it couldn't be kinder to him than the president. The president is so unkind to him. And I think that this year there's been common agreement among – I mean, look, nobody likes him. And one of the problems is he can't – like when I say nobody likes him, as Daniela will tell you, especially nobody likes him at the state capitol. The legislators don't like him. The Democrat legislators don't like him. The Republican legislators don't like him. And that makes it very hard for him to get his agendas and his ideas through. I think he has put more on the table during this session than anybody else, and they haven't done anything with it. But one part of that might be a little bit of his own making, which is that he wasn't ever a good bridge builder and alliance shaper.
How much does that really play a factor? This idea of maybe he just doesn't get along personally with the people up there who he needs to work with.
Well, he's an outsider. He wasn't a creature of the building. He came from Stanford. He was a mayor. He was it's just a different model, a different type of person.
He kind of showed up and told everybody to go soak their heads too.
Yeah, I mean, but part of it is personality. I mean, that's what I'm saying. It's just the way he is, and you called him the porcupine, right? So
he called himself the porcupine.
He called himself the
yes.
porcupine. That's right. Yeah. But I just was thinking about what Colin said. About how popular Charlie Baker is. I mean, Massachusetts has huge problems. $15 billion in unfunded pension liabilities. But yet here in Connecticut, we're always walking around. Oh, nobody likes us. We suck. Like bad luck, schlep rock or something. And it's just it's the Connecticut goggles, maybe, like you were saying. That we just sort of have this notion that we're down and out and everybody's leaving and the state's awful. And
I like the voice you use.
Yeah.
It's the Connecticut voice, and it just
One of Daniela's improv characters she does.
since we mentioned Charlie Baker, I mean Charlie Baker and Phil Scott in Vermont, two of the most popular governors
Larry Hogan.
in America. But I mean, we're talking about people who are running against and away from Donald Trump. They seem to be part of the Republican Party, but a different part of the Republican Party. And I don't know, Matt, in that thing that you said earlier where,
the competence wing at the Republican Party.
well, okay, so it's the competence wing, but if only 9% of Republicans actually believe that some of the stuff that Trump does is a problem, or 83 or whatever it is percent of people support him, even if they don't like some of the things that he's doing, I don't know, is Charlie Baker sort of showing a new way for a Republican Party that can appeal to Democrats in a blue state, even a blue state that has, a boatload of problems like Massachusetts does?
Yeah, I think there's potential for that in Connecticut. We've seen it before, even though those people, the Republican governors here had their own issues, Yeah, I think that's a model that can work in blue states. You're not going to see a Charlie Baker anywhere south of Maryland or west of Maryland, I don't think. But
yeah. Colin, a quick thought on that? I mean, does a Charlie Baker type show up in Connecticut?
I don't know that that's who's going to win the 2018 election, if that's what you're asking. I mean, I don't see really who that person is in the field right now. But I think I said last week, I don't think the field's complete yet. And there may be somebody like that who will emerge.
When we come back, we'll talk quickly about the fact that maybe as many people as we'd like aren't running for office. I mean, given all the things that we've just said about the mess that we have, maybe that's not so surprising. We'll talk about that and some other things with Colin McEnroe, the host of the Colin McEnroe Show on WNPR. Matt Dorenzo, Executive Director of Lion, and Daniela Altamari, State House reporter for the Hartford Courant. This is The Wheelhouse. John Dankosky here. We're talking about the week's news with Colin McEnroe from WNPR, Matt Dorenzo, who's the Executive Director of Lion, and Danielle Altamari, State House reporter for the Hartford Courant. Matt, you drew our attention to something that was in the Courant, a story that maybe we see every once in a while, but it basically goes like this. People aren't lining up to run for office because maybe being an elected official isn't all that it's cracked up to be. I mean, should we make anything of this, that maybe people aren't turning out to run for everything from the Board of Selectmen in your town to deciding to run for governor?
Well, as Colin was saying offline, it seems like the story's written every couple of years. And the difference this year, I think, is all of the mobilization after Trump's election. People on all sides of the political spectrum, but you had the Women's March on Washington, with tens of thousands of people being bused from Connecticut down there. In my town of Litchfield, we had packed meetings and still having packed meetings of mostly women interested in politics. But the disconnect comes when, we'll run for school board. I'm pretty happy with my local schools. Run for first selectman. I mean, what does that have to do with Trump? We have a Republican first selectman who may agree with Trump on some things, but he keeps the roads paved and it's all good, Plus, I don't really want to maybe be involved in the finer points of zoning regulations and stuff like that. So,
yeah, and maybe you don't want to get into big arguments with your neighbors. I don't know, Danielle. Is there anything to this? Maybe people saying this whole life of public service is not really for me because they're just going to complain about me on WNPR.
It's hard. I mean, people complaining about you on the radio, people writing critical stories or editorials about you. It's a lot of time, a lot of drudgery. I mean, let's face it. Anyone who's covered local government in Connecticut and sat through some of these meetings as a reporter, it's not glamorous. It's not, it's not jetting around on Air Force One. I mean,
well, and that's for sure.
Right. I mean, the only real advantage to being a state legislator that I can see is that you can drink during work hours and no one will ever discipline you. But we covered that in a previous Wheelhouse. But I think the thing that should worry people, particularly at the local level, is that when everybody else clears out, when the kinds of parents that Matt's talking about think, well, I can't run for Board of Education, and when decent-minded people decide that the whole thing is just too rancorous and too onerous to do, what's left are crazy people, extremists, and opportunists. That's sort of who you wind up with running for election. So you have, there are always going to be sort of wacko gadflies who would be thrilled, and in a vacuum, they maybe have a better chance of winning. You have sort of, one of the ways that the Tea Party rose up through the grassroots is, a lot of times there were seats that were going begging, and so as somebody with kind of extreme views, maybe you had a better chance than you did in the past when you had to run against a more crowded field. And then, I mean, there's another group of people who like to be in public office in Connecticut because they can turn it to their advantage. They can steer work to cronies and companies and stuff like that. And so to them, it's going to be worth it. It's going to be worth it to chair certain boards and committees. And so that's why you want the other kind of person, the altruistic, civic-minded person to run. And if they don't run, there's a vacuum, and that's what happens.
I don't know, just what's in it for them, though, Matt? What really is in it for the altruistic person who wants to just make my community run better?
Well, I think, think globally, act locally is the old environmental slogan. And I think people who got involved in the Women's March and felt so strongly and still do, it starts with your school board. Starts with I think the Women's March people should take over Democratic town committees or Republican town committees if they want to get involved.
We're not seeing a whole lot of folks lining up to run for Congress this time around either. I mean, we have a huge cast of characters who's interested or exploring runs for governor, but we don't, see a lot of people at this point at least, and it's getting late for 2018, running for Congress or for U.S. Senate. We don't see a lot of big names in any of those races at this point on the Republican side.
Although we never do. I mean, those seats are not competitive for the most part.
I would think we had two very competitive Senate races the past two cycles.
We just have a couple minutes left. I want to quickly ask Matt about a piece that you wrote in response to an op-ed that you saw in your local newspaper, an op-ed that seemed to say, slavery, long time ago, not such a big deal. I mean, I'm paraphrasing here.
Right. So this was in op-ed column in the Republican American of Waterbury, my local paper, by a guy named John White. And it started off talking about the efforts of liberals to tear down Confederate monuments and stuff like that. And it laid out the case that slavery was not so bad because his grandparents, great-great-great-great-grandparents had slaves and they were nice to them, that they volunteered after the war was over, that slavery has been around for 10,000 years, that black people have had their own slaves. It was literally, what about black on black crime, retort to slavery. So I'm not the most articulate person to respond to this, but I also feel like people of color shouldn't have to respond to every one of these things, and that as a white guy, I should stand out against white guy extremism.
But we see things like this written, and there's a lot of different ways to write this. I mean, is there anything particularly that struck you about it being in your local newspaper, on like the thing that you open up in the morning, as opposed to it being an online comment?
Absolutely.
We've certainly seen that.
My 10-year-old daughter reads the paper from cover to cover, and how to explain the normalization of holding another person as their property, and the complete denial of past sins. Is just.
A quick thought, Danielle?
Just a quick thought. Everything that you're saying in substance is really interesting and on point, but just what you said about your 10-year-old daughter reading the newspaper. Yay, that's awesome. How many 10-year-olds are reading the paper? That's great.
We're glad to see that.
There are some points of view that maybe don't really even deserve an airing, and that this might have been one of them. I mean, I don't. This is such an odd thing to say, but it's also an indication of the kind of blindness that a lot of us do have about this. I'm still a little bit chilled during the 2016 campaign. I asked Jane Sanders, the wife of Bernie Sanders, her favorite novel. She said Gone with the Wind. Gone with the Wind is a real Valentine to slavery. It really does make slavery seem far more palatable than slavery was for slaves. So there's still work to be done. I mean, the current, particularly in the person of Ann Farrow, did this amazing thing called Complicity, which really looked at the role slavery played in the creation of wealth in Connecticut. And we still have a lot of parsing of that to do. I mean, slavery is a grievous moral wrong. We haven't outlived the consequence of it here in 2017. We won't probably have outlived the consequences of it 50 years from now, too, so we need to keep talking.
And I'm sorry I've left just a minute for this column, but it was nice. We've led up to this over the course of the last couple of weeks, and some of the things we've said about the nasty stuff people say about Connecticut. You were able to finally write the column you really wanted to write about Mark Bertolini, the chief executive of Aetna, who's decided he's going to go live in New York.
Yeah, I mean, it's just been silly to say, and I've heard it said even on this show that he did it because of Connecticut's unpleasant tax structure. Obviously, New York City has a city tax. Nobody moves to New York City because the tax situation is more beneficial. He's moving there for various reasons. He's not, as Daniela just said a few seconds ago, moving the company there. He's sort of moving the headquarters. He's moving his highest paid people there. People should read the column that I wrote. I was surprised at how many people wrote to me and thanked me and said this needed saying. I will say that I also heard from a lot of people who worked at the Aetna who maybe took early retirement and were prepared to tell me things now that I had not known. So I know more. And I suppose we'll be dribbling some of that out over the next year or so.
So we'll continue reading Colin McEnroe, both in the Hartford Courant and also, of course, here on WNPR. Hey, thanks, Colin.
Thank you.
Thanks to Matt Dorenzo, Executive Director of Local Independent Online News, or Lion. Thanks, Matt.
Hey, glad to be here.
And thanks to Daniela Altamari, State House reporter for the Hartford Courant. Keep fighting the fight over the Capitol, Daniela.
Thank you.
And read your local newspaper. Our program is produced by Kyone Wolf. Heather Brandon is our digital editor, and the executive producer is Katie Tolarski. I'm John Dankosky. Thanks for joining us in the Wheelhouse.